One of the pivotal moments in my Feldenkrais learning career was Dr. Feldenkrais's lecture on health. He posed a question, what is health? And it's a funny sort of thing, because being a physical therapist, being part of the medical community, I thought intuitively that I understand what health is. But when I tried to answer the question, it was challenging. I thought of absence of disease, but then absence of the disease doesn't work really, because you have some people who have no diagnosis, nothing wrong with their MRIs and their X-rays, and at the same time there is lots of suffering, and you wouldn't call these people healthy. On the other hand, you have some people who do have diagnoses, sometimes really serious diagnoses, and the way they conduct themselves is stellar. You would call this is a model of health, and the person has scoliosis or some other troubles. So the presence of disease is not a good enough measurement of health. Another thought that came to my mind was well-being, but to Feldenkrais, it was just muddying waters. He would say that phrases like well-being are so vague that they actually hide meaning rather than conveying meaning. How would you measure well-being? Then he went ahead and asked, how would you measure health? And he borrowed his definition of health and measurement of health was from large systems like big, huge corporations, businesses, or even countries. The measure of a large system well-being is the size of shock that it can take without its process stopping. So the human system, us, are huge systems. They are enormous. The numbers of cells in our body are humongous. And to him, the health could be measured by the intensity of the shock that my system can take without losing our normal way of living, without losing the quality of our everyday life. But health is also something dynamic. We should not cling to it, hold on to it at any price. It's more of a dynamic moving toward homeostasis and away from the homeostasis. It's the dynamic dance back and forth, rather than trying to get to health, to perfect health, and holding it. The same thing comes from in terms of injuries. In terms of injuries, you don't want to avoid injuries at any price, because this way you would stop playing any sports, you would not ski, you would not do anything, you wouldn't walk because what if you twist your ankle or slip and fall? So what we want to do is we want to become resilient, capable of coping with injuries. The same applies to any chronic condition. We know from the evidence that most chronic conditions have the nature of relapses. You have re-injuries, setbacks, flare-ups. When you have a flare-up, please don't despair. It's normal to have ups and downs in your situation. What we can learn from Feldenkrais is how to have the relapse and then have tools to bring yourself back to a state of homeostasis, and not in years or months, but quickly, knowing how to create an environment for healing, for getting better, both mentally, but also physically. And we can learn that. Some people, even when facing grim diagnoses, really bad news with terrible diagnosis that not necessarily will go away, are actually able to take that blow, that crisis, had converted into something magnificent. Some people in their last weeks and months of their lives are capable to create such transformation and such a meaning in their life that that's the life worth living.